I'm Kristen Calloway. I am the CEO and president of Strategic Practice Solutions, a full-service RCM company. We also do consulting, and we work mostly with surgeons. I've been working with MedEvolve for 8 years. It's been great. I started working with MedEvolve because the first client I had was using MedEvolve, but it was really kind of divine intervention because MedEvolve turned out to be the system that we would end up loving. And the people in my organization have touched hundreds of systems in all over the country, and PM and EHR, and this is the PM that we prefer. So when we meet a client, a prospective client, we look at the practice or the organization as a whole. And we never want to recommend anything that's not going to create the cleanest, most streamlined workflow. And so far, every practice that we've walked into, MedEvolve has been the best choice for that. One of the things that I tell practices, because what we do with RCM, we wrap the process around MedEvolve. So we use the insurance collector and different modules in the system to their fullest. If we were to use the system that they're using, it would seriously hinder us from doing what we're really good at. A lot of practices I go into, they have an integrated system. So they'll have the EHR and they'll have the PM attached to it. And a lot of times we find with other systems that the EHR is very robust and has everything that the practice needs for clinical use, and that's great. And then the PM was kind of thrown on there as an afterthought. We really think that, yeah, it's great if it's integrated and it really works and it does everything that the practice needs it to do, but a lot of times we find it does not have the tools that you need to do the accounting piece, which is how the money gets into the practice. So what sets MedEvolve apart is, for me, the insurance collector, the ability to QA what my staff is doing, because I can't see everything. So from 1,000 feet, I'm able to, through the reporting, the data mining, and now analytics, which we love, we're able to just see a lot from 1,000 feet because you can't sit behind everyone that's in your organization and watch what they do all day. You have to have the tools to see what's going on. So I always recommend MedEvolve. So they are our PM of choice, and as I said, I have good reference. I've used a lot of different systems, and I recommend them. I do some consulting where I don't take over the accounts receivable, and I go in and try to help an already established business office to streamline their already existing workflow. Everywhere we've gone, we've actually implemented MedEvolve, so I definitely recommend MedEvolve.